Have you noticed that your morning erections aren't as strong or as frequent as they used to be? It's one of the most common concerns I hear from men over 60. You wake up and realize what used to be automatic now takes effort. It's not just in your head, there's a real physiological reason behind it. As we age, blood flow slows, nerve signals weaken, and the pelvic muscles that control erections lose tone. But here's the good news, your body still knows how to respond. You just have to remind it. And you can do that with a simple, natural 5-minute pressure point routine that reactivates your body's natural erection reflexes. No pills, no pumps, no embarrassment. I'm Dr. Carolina, a urologist specializing in men's health. My goal today is to show you 3 pressure points that can help improve blood flow, nerve sensitivity, and control. They're completely natural, safe, and backed by what we know about anatomy and circulation. Now, before we go into technique, let's quickly understand the problem. Erections depend on 3 things: healthy blood flow, responsive nerves, and strong pelvic floor muscles. When those weaken, you lose the quick morning response and the firmness you used to have. But you can train these systems just like any other muscle group. By stimulating specific pressure points, you send fresh blood into the area, wake up the nerves, and remind your pelvic muscles how to work together. So let's go step by step through the 3 key pressure points and how to use them. The first point is called the base groove, located right at the root of the penis where it meets the body. This is one of the most important zones for blood flow and nerve signaling. Using your thumb, apply firm but gentle circular pressure at the base groove for about 90 seconds. Move in small, slow circles, pressing deeply enough to feel the tissue but not hard enough to cause pain. This boosts microcirculation, reactivates the sensory nerves that trigger arousal, and helps the arteries deliver blood more efficiently. Do this daily. Ideally when the area is warm, for example, during or after a shower, so the vessels are relaxed. The base groove massage works like a wake-up call for the system that controls blood inflow and retention. Next, move slightly lower to the perineum, the soft area between the scrotum and the anus. This is a crucial pelvic floor hub that connects the muscles responsible for erection strength and ejaculation control. Use your fingers or the base of your palm to gently massage this area for 2 to 3 minutes in small circular motions. Breathe normally, stay relaxed, and never press too hard. Over time, this strengthens the pelvic floor muscles, especially when you pair it with Kegel exercises. To do a Kegel correctly, tighten the same muscles you'd use to stop urinating midstream. Hold for 3 seconds, then release for 3 seconds. Repeat 10 times while you massage the perineum. These muscles, the bulbocavernosus and ischiocavernosus, help compress the veins that drain blood from the penis, which is what keeps an erection firm. Now, for the third point, the corona. This is the sensitive ridge where the glans, the head of the penis, meets the shaft. This area contains thousands of sensory nerve endings that become less responsive with age or disuse. To recondition these nerves, gently pinch and release around the corona using your thumb and forefinger in a soft rhythm. Do this for 1 to 2 minutes. The goal isn't stimulation, but retraining. You're restoring nerve awareness and helping the brain rebuild its connection to the arousal response. Altogether, the entire routine takes about 5 minutes. You'll spend 90 seconds on the base groove, 2 to 3 minutes on the perineum, and 1 to 2 minutes on the corona. The best time to do it is in the morning or during a warm shower when blood flow is naturally higher. Remember, consistency matters far more than intensity. Light, regular practice builds cumulative results. So what can you expect? In the first 2 to 4 weeks, most men notice subtle changes. A sense of warmth, a fuller feeling during arousal, or stronger morning erections. With continued practice over 2 to 3 months, those improvements become more consistent and noticeable. You're essentially retraining your nervous and circulatory systems to respond the way they used to. Now, let's talk safety. Keep your nails trimmed, your hands clean, and avoid any broken or irritated skin. Use gentle pressure. This should never cause pain, bruising, or numbness. If you're on blood thinners or have sensitive tissue, go even lighter. Stop immediately if you feel discomfort or tingling that lingers. This method is meant to wake up the area, not overstimulate it. If you ever feel soreness or burning afterward, that's a sign to reduce the intensity. A warm compress after your session can also help increase comfort and blood flow. To get the best results, pair this technique with supportive habits that help your entire vascular system. Stay hydrated. Dehydration thickens your blood and reduces circulation. Do regular pelvic floor exercises to reinforce the muscle control you're reawakening with the pressure routine. Eat a heart-healthy diet, plenty of leafy greens, beets, pomegranate, avocado, and watermelon. These foods are rich in nitrates, potassium, and antioxidants that boost nitric oxide and improve vessel flexibility. Stay active. Even 20 minutes of brisk walking daily improves endothelial function and testosterone levels. And never underestimate sleep and stress control. Chronic stress raises cortisol, which blocks testosterone, while deep sleep boosts it naturally. You can also consider optional supplements if approved by your doctor. Citrulline-rich watermelon extract supports nitric oxide production. Herbs like tonkat ali, fenugreek, and nettle may gently raise free testosterone or circulation. Just make sure they're high quality and used under supervision. Now, you might be wondering, can such simple pressure points really restore stronger erections after 60? The answer is yes. When you understand why they work, erections are a reflex, part physical, part neurological. Over time, reduced activity causes the nerves and vessels in this region to become quiet. Regular stimulation reawakens those pathways, improves blood oxygenation, and rebuilds muscle coordination. It's not about forcing the body, it's about reminding it how to do what it already knows. And unlike medication, this method improves the underlying systems rather than just triggering a temporary effect. Finish with another deep breath. Of course, if you experience persistent erectile difficulties, pain, or changes that don't improve, see a doctor. Some strong erections are a reflection of strong circulation and good nerve health. When you care for that system, you're also protecting your heart, your brain, and your overall well-being. So don't think of this as a quick fix. Think of it as self-maintenance, a daily reminder that your body still works beautifully when you give it attention. If this guide helped you understand your body better, give it a like so more men can discover natural, science-backed solutions that actually work. Subscribe for more clear medical advice about men's health and performance. And share this with a friend who might need encouragement, because no man should feel like age has taken away his vitality. I'm Dr. Carolina, reminding you that strength isn't just about youth, it's about awareness, consistency, and connection to your own body. Take 5 minutes each morning. Activate your pressure points. Keep your blood flowing. You might be surprised by how much power is still waiting inside you.